Good evening, everyone, and thank you for tuning in to Life Sciences of Washington, How to Eat to Live Facebook channel. Um, Hold on, we're having some technical difficulties real quick. Thank you very much. Now we got those handled. We thank you all for tuning in tonight. Dr. Patrice, can you hear me?
Yes, I can.
We are waiting for Mr. Victor Muhammad to get his video up. Mr. Victor Muhammad, can you hear me? We thank you all for tuning in tonight for our program to deal with dealing with the great potential uses in health of interferon gamma. We understand that most of you have come to know interferon um, alpha, and Mr. Victor Muhammad tonight would like to express to us the values of interferon gamma as it relates to our own health. Mr. Victor Muhammad, can you hear us? Hold on, let me see if I can get him out. Can you hear us, Mr. Victor Muhammad?
Yes, I can.
Okay, is it possible to get your camera on?
Yes, it is.
Thank you very much. We now have our keynote speaker for the evening, Mr. Victor Muhammad. We have Dr. Patrice Muhammad and myself, Brother Erica Hod of natures-v.com. Thank you all for attending tonight. The subject matter that we will be covering will deal with the great potential health uses of interferon gamma with biomedical research scientist and creator of low dose liquid alpha interferon, Mr. Victor Muhammad. Thank you for coming tonight, Mr. Victor Muhammad. Can you give us just a little intro to why tonight is such a special night as it relates to the new product release that we have in IB19 and your thoughts on the direction that interferon gamma or IB19 will be taking us into our health and our future?
Yes, and thank you very much for the introduction. My name is Victor Muhammad, and I've been a biomedical and agricultural research scientist for the last 37 years. 28 years ago, I was blessed to develop a biological that somewhat changed the paradigm in healthcare in this country, and it has begun to have an influence on the world. The product of which I speak, we were working with the Abundant Life Clinic and several other doctors and clinicians around the country in San Francisco, Los Angeles, Atlanta, Chicago, and New York, Washington, D.C. And they were using the product that I was blessed to develop in November 1994. This product was a product where interferon alpha, native or natural interferon alpha, was the main substrate in the product. And we've gotten such good results during those times from the product that we began a little while ago studying the effects of interferon gamma. Interferon gamma belongs to a set of proteins that are naturally produced by the body's own immune system. And the one that is most recognized by the medical and clinical world is interferon alpha. Interferon alpha, nor gamma, nor beta is a drug, because these are entities that naturally occur in the environment, and they naturally occur in your body. So it can't be a drug. And so what we started doing shortly after leaving graduate school in 1988 is started studying the effects of these proteins in vivo systems. And what I mean by in vivo is inside of a body, any kind of body. And we found that these products have tremendous health benefits, not what you would call the same as, let's say, echinacea or something like that. I can't speak on the efficacy of things like that because I don't know anything about it. But I can speak on the efficacy of a product like interferon gamma. So after graduate school, we started researching these things and we found that they were very, very uh, promising in their ability to treat, not treat, but their ability to help in the recovery of some diseases. So we found that interferon gamma has greater properties actually than interferon alpha. Interferon gamma uh, has a very, very broad mechanism of action. And so as a result, what we've learned over the years is that this is something that needs to be given more study and it needs to be put in more practical applications in terms of healthcare. Uh, Mr. Ahad.
Thank you, um, Mr. Muhammad. Um, with the relationship that most people have with the interferon is that they understand it in the manner of interferon alpha, because interferon alpha now is more predominantly in the news as it relates to the current viral pandemics going on. I wanted to show this Time magazine cover from March 1980 to our viewers because this is interferon alpha as it relates to cancer and other viral issues. What is the specificity of interferon gamma as it relates to the body and the things that you have found in your scientific research that it does help the body either heal from or help the body naturally um, get back to homeostasis?
Interferon gamma is a very broad spectrum protein. It works in curing and treating malaria. It causes the NK cells and T cells, the phagocytes, the eosinophils. It triggers the the natural killer cells. It activates the resting cytotoxic T lymphocytes. It helps in the production of your immunoglobulins, IgG and IgE, I believe. And these are immunoglobulins are critical in the fighting of infection, mostly from bacteria and protozoa. But interferon gamma triggers all of these cells in the body and it activates them to go out and start doing what they do. If you've seen the movie Independence Day, I think it came out in the mid 2000s. In the movie, when the U.S. fighter planes were approaching the mother plane, it triggered the presence of these U.S. Air Force jets, triggered all of these little planes or baby planes to come out of the bottom of the mother plane and began fighting. That is almost a parallel, a direct parallel of what interferon gamma does when it is triggered, and the cells that produce interferon gamma, I believe it's the T cells and NK cells. Once they are triggered to start producing interferon gamma, and they excrete interferon gamma into the body's immune system, then when interferon gamma is expressed into the immune system, it triggers these cells to start coming out of their hiding places and their resting places. And when they leave their resting places, they have one intent, and that intent is to come out and start killing anything that's foreign to your body. And so this is why it is so effective. And it works in collaboration with interferon alpha, with immunoglobulins, and other proteins and other parts of the immune system, the phagocytes, the eosinophils. And these are all cells that work to deal with things like respond to asthma, what you would call asthma, inflammation. Um, and it has a broader scope of operation than the interferon alpha does. Interferon gamma works in fighting and destroying tumor cells. And a tumor is just another name for cancer, or cancer is just another name for tumor. So when you hear someone say, I have cancer, theoretically, that means that a tumor has been found somewhere in their body. And interferon gamma has been proven to be very effective in destroying tumor cells. So those are just that's just a surface description of the properties that interferon gamma possess.
Thank you very much. The interferon gamma and the interferon alpha, as it relates to viruses or bacteria, um, what is the specificity between the two? Since you have created a product that's IB100 that you have given to us to address most viral issues, what would you say is the best therapy or therapy for a person to use IB19 for? So,
I think that and that's a good question. Um, I think that the when if you apply a product that contains interferon gamma to a human being, and that person is suffering from a diagnosis from a clinician, a medical clinician, and that person has been diagnosed with something like cancer, um, diabetes, tumors, asthma, um, protozoa infections, bacterial infections, viral infections, edema, swelling of the joint, generally caused by a bacterial infection. Um, any of these kinds of diagnosis by a clinician. I'm not a clinician, and so I don't have the ability to diagnose anyone. But if a person has been diagnosed by their clinician, we believe that a product that contains interferon gamma would be very effective in arresting the symptoms and possibly arresting uh, arresting that disease in that person. The if there is if there is to be a difference between interferon gamma and its effect and interferon alpha and its effect, it would probably be that interferon alpha has shown to be very effective in arresting viral diseases, diseases that are caused by a virus, influenza, hepatitis, um, the common cold. It's been shown to be effective against Ebola, HIV, AIDS, as well as coronavirus. And if I were to describe the effectiveness of interferon gamma, I believe that it covers a much broader cascade of infections, ailments, diseases than the alpha does. It triggers uh, so many other parts of the immune system and causes it to go into action as opposed to what happens with the interferon alpha.
Thank you. I want to bring Dr. Patrice, and thank you for your patience, Dr. Patrice. Um, we had talked earlier about going a certain direction, but I believe now with Mr. Victor Muhammad's um, representation of the products that we currently are talking about, can you tell us some of the successes that you had with the IB100 to let our viewers know from a medical clinician perspective the efficacy of that product? And because Mr. Victor Muhammad has said that he believes that IB19, his latest development in this dietary supplement product, has even a greater efficacy um, in helping people therapeutically, um, dietary, supplementary, get beyond the issues that they're dealing with. Can you give us some background on what you've had success with IB100?
Yes, sir. And thank you all for having me to this conversation, to this discussion, this very scientific discussion. And I have a case study log here, and it has patients that I've seen and have recommended the IB100 and IB30. The majority of my patients have been on IB100 for rheumatoid arthritis, for systemic lupus erythematosus, chronic headaches, uncontrolled blood pressure, benign prostatic hypertrophy, that's just the enlargement of the prostate, type 2 diabetes, prostate cancer, chronic renal disease and failure, Bell's palsy, congestive heart failure, coronary artery disease, chronic low back pain, varicose veins, multiple myeloma, severe environmental allergies, HIV, herpes simplex 1 and 2, amyotrophic lateral sclerosis, which is Lou Gehrig's disease, they call it ALS, COVID-19, metroralgia, which is for a female, the prolonged menstrual period and heavy bleeding, degenerative joint diseases, which is osteoarthritis, cystic acne, methicillin-resistant staph aureus, which is MRSA, and acute myeloid leukemia, as well as 16 patients in particular are taking IB100 for either active, they were diagnosed with COVID-19, or they have been exposed to someone in their households or at the workplace with COVID-19, or they just want to have IB100 as a safeguard in case they get infected. Then the robust response from the immune system will go and eradicated prior to developing the symptoms, especially the inflammatory response that seems to wage such havoc on the body and cause a person to spiral and cause them some significant effects that warrant them to be on a respirator.
Thank you, Dr. Patrice. I want to address something that I think that would help our viewers understand. With both of you here, we get to look at it from the science side of the equation and also the medical health side of the equation. We have are experiencing, our viewers are experiencing a large abuse of antibiotics in the world today that have caused a lot of them unable to use simple antibiotics like penicillin or ampicillin or moxicillin these days. And with that being said, and then the higher forms of antibiotics that they're being given, first, Dr. Patrice, do you see the abuse of um, antibiotics in the medical uh, industry as it relates to prescription? And second to you, Mr. Victor Muhammad, if the body becomes resistant to these antibiotics, would IB19 be of use to a person as opposed to these other um, higher grade antibiotics that are causing the people's immune system or body unable to fight off the bacteria with the normal cillins that exist today? We've lost your camera, Mr. Victor Muhammad, but I'll go to you first, Dr. Patrice.
Yes, sir. Of course, there has definitely been an abuse of antibiotic therapy. You find someone all too often that may get upset with me in the ER when I don't prescribe an antibiotic for basically a bad cold, a common cold, a viral infection. There are too many primary care providers, family practitioners, even internists that will prescribe antibiotics when it really should not be. It's basically to appease the patient, or if there is a sick child who again just basically has a viral infection that's basically has to kind of run a course. You treat it symptomatically over 7 to 10 days. Actually, a cold, a common cold, upper respiratory infection can last up to 10 days. And after that time, then we say they have a persistent upper respiratory infection, and we may give an antibiotic because there may be a bacterial cause somewhere there. So some practitioners will give an antibiotic. So yes, there are many, many, many studies that document the age of antibacterial resistance, which we are definitely in and have been in this state for quite some time. So yes, has been an abuse of antibiotic therapy for many years, which again, as you said, it does work on the immune system, as well as it really causes a major problem with the colonic or intestinal bacteria, the good bacteria that's killed off, and the brush border of the intestines is almost destroyed. And that's when you get yeast infections, which is an opportunistic infection, and you may get diarrhea and other problems with the intestinal system due to the harm that antibiotics can do to the body and the intestinal system.
We've lost Mr. Victor Muhammad, but we'll continue because your background with interferons is over 25 years, and you've used it with many of your patients and used Mr. Victor Muhammad's dietary supplement for immunotherapy for quite a long time.
Yes,
so until he returns, I want to, if you don't mind, ask you some more questions as it relates to that.
Sure.
So the overprescription of antibiotics. I went to the dentist the other day, and I happen to be of those who need antibiotics before they go to the dentist. Mr. Victor Muhammad has returned. I will present this question, let you answer it. And they said they no longer have to. They no longer have to. There it is. Okay. They no longer have to prescribe it. We lost your picture again, Mr. Muhammad. They no longer have to prescribe it before I get my teeth done, but they told me because of the resistance that it's causing by overprescription. When you know the side effects, you know the history of these two products that we have here in IB 100 and IB 30. Now, something that is another IFN product of the gamma nature, do you think that it would be able to help a person who has become resistant to other antibiotics based on what you know of the the gamma um, type or characteristic of interferon?
Yes, sir, absolutely. Actually, I've already contacted a few patients who are having some success actually with IB 100 for cystic acne and for a couple of bacterial infections, skin and bacterial infections, MRSA in particular. I am actually very anxious to start them on IB19 for that because, from what I understand, it may have a more efficacious effect on the bacterial overgrowth for cystic acne and for the methicillin resistant Staph aureus.
Thank you for overcoming the technical difficulty, Mr. Muhammad. We were just discussing, hey, we have to go through these things as we move forward, but thank you very much. We were just discussing the over prescribing of antibiotics and people's inability to take the Cillin version, of antibiotics that we all become um, accustomed to, and now you're taking these super antibiotics that are causing people's inability to get over bacterial infections. First of all, the question is, will can the characteristics of a IFN gamma or IB19 help those people who have now become resistant to all of these other antibiotics? And do you see it allowing the people who are no longer able to fight off these bacteria having an answer to the issues that have been caused by pharmaceutical abuse of antibiotics?
Well, the short answer is yes, sir, without question. First, I'll say this because I think it's important to always get information out when you have the opportunity. There are a great number of diseases that are affecting humanity as we know it. And a great number of those diseases are not necessarily biological. I believe that people are suffering more from mental and social diseases than they are the biological ones or the biomedical ones. That's not part of what we're discussing tonight, but that's been on my mind pretty hard today, and I wanted to say that. And I wanted to make certain that people understand that the average American is suffering from a mental or social disease right now. Now, in particular, your question, I believe that the same phenomenon that would cause the human being to require an exogenous, meaning one from outside the body, source of interferon to treat a disease is the same or very similar to the reason that these same products that contain interferon alpha or interferon gamma, being given to the body uh, in response to the body becoming immune to or resistant to antibiotics, is almost for the same reason. What does that mean? If you continuously give yourself um, an antibiotic, ampicillin, and over time, that's prescribed to you twice a year for some kind of infection. In many cases, physicians prescribe antibiotics to a person who has the cold or flu. And any physician worth his weight or her weight in Kool-Aid would know that antibiotics don't work on viral infections, but yet they prescribe it. And because John Q. Public or Juanita Banana is not aware that antibiotics don't work on viral infections, they take it because they trust their doctor. But what happens is that over time, when you introduce constantly any substance to the body, including snake venom, if you introduce it to the body enough and the concentration is not enough to kill the person, what happens is that the person becomes resistant to that protein that's being introduced into the body, or in the case of an antibiotic like penicillin. And when we used to test these kinds of experiments on bacteria in the laboratory. So what we would do, we would dilute penicillin, ampicillin, streptomycin. We would dilute them, and we would place the diluted concentration of the antibiotic in a cell culture dish with some kind of cells. And over time, that cell would we would introduce a bacteria to the cell, and over time, the bacteria became resistant to the antibiotic. And the same thing happens in my body after taking antibiotics for 5 years, 10 years, 20 years, 30 years. Then all of a sudden, there is no antibiotic strong enough or has the specificity to attack whatever infection you may have. And so, what we believe, what I believe, is that something has happened to the body of the human being, whether it's environmental or stress or dietary. I haven't been able to put my finger on it yet. But I believe that something that we are doing to our bodies is causing the body to stop producing its own natural interferon, whether it's alpha, gamma, or beta, and many other of the cytokine proteins. I believe that either you've been given something under the guise of a medication, a vaccine. I don't know. So please don't quote me, because I don't know how it's being done. But I do believe that something has happened to the body of the human being where your body is no longer producing interferon alpha and gamma in response to infections. And this is the only way that you can be compromised. Your body can be compromised. And what I mean by compromise, you die. You physically die from a viral infection. And there's no reason under the sun where a healthy human being should die from a viral infection. There's just no reason for it. I mean, the body is designed to fight off any kind of infection. But when we do things or we trust people and they give us substances, I believe that we've been given something that prevents the body from producing these things in a natural way. That's my belief, Mr. Ahad.
Thank you, Mr. Muhammad. Many of our viewers are not familiar with the natural aspect of healing the body. Dr. Patrice, you are a certified naturopath. Is that correct?
Yes, sir.
Can you? Okay. And Mr. Victor Muhammad, you are a biomedical science research scientist who have dealt with the human body. Are pharmaceuticals advantageous at this point in their development for the human being? This is just an opinion that you or perspective or your professional opinion. I'll start with you, Dr. Patrice, and then I'll come to you, Mr. Victor Muhammad.
I would say absolutely not, because God made everything that we need to maintain this body, and it's in nature. So, no, I would say absolutely, emphatically not needed to maintain this wonderful creation. And I just wanted to add this before I go further in that regard, if I may please. There is a 2013 study that shows vaccines actually harm the immune system's ability to handle other pathogens, and actually make you more susceptible to other bacteria. So, other microorganisms. And so I'm just speaking to what Mr. Victor Muhammad just stated about something is causing the body not to produce the interferons that we need to protect us. And so that's in a study that states that vaccines across the board, vaccines, it didn't specify one, although this particular document that I have is speaking of the influenza vaccine, but it makes reference to vaccines in general, that they actually harm the immune system's abilities. And as I stated, for pharmaceuticals, when there is a dis-ease or an imbalance of the body, we get signs. We get initial signs. The blood pressure is there, the headache is there. Something occurs before it, in some people, it develops into a tumor or a malignancy or cancer. So when that happens, there are many, many avenues that we could go. As I have a degree in integrative medicine, there are so many therapies that I cannot name them all, of natural or naturopathics, of a naturopathic spectrum, that can help to bring the body back into homeostasis or balance. Unfortunately, we're not getting that information in our communities and in society. What we are getting is, I'll write you a prescription. You're getting something that is given, you're giving a drug that is a Band-Aid, and it does not get to the root cause of your problem. And so a pharmaceutical drug, not only does it not address the root of the disease or the problem, it actually comes with its own set of problems and side effects. So it may help take the headache away, but it's causing a problem with your kidney, or it's causing a problem with your liver because of how it's processed. So I am aware. I have been recommending natural therapies for many years. However, they, of course, the insurance companies, the powers that be, do not reimburse for natural therapies. They give you some offshoot of some health program within your company that some companies do not have. And they say, oh, well, you pay into this healthcare spending account. And then when you want to go to those other people who do other things besides besides them giving you a drug, then you just take it out of that account and you'll pay for it yourself. So they just give you a slight pre-tax advantage or benefit on your health spending account. But again, I could talk about natural health and healing all day long. So the short answer to your question, Mr. Ahad Muhammad, is no. Therapeutic or pharmaceutical agents do not cause therapeutic, when in the real sense of the word, a therapeutic resolution.
Mr. Victor Muhammad, your background is extensive in the field of biomedical sciences as a research scientist with cancer, HIV, the development of pharmaceutical drugs, the laws that allow them to be developed. You speak to us about the new health paradigm. Can you give us a picture of what the new health paradigm looks like, as we are all too familiar with what we have in the Western medicine effects of what's going on? But please share with us, what is the future as it relates to the new health paradigm that you see for us?
Yes. Anyone who has reasonable vision should be able to see that we have reached the end of the Western world. What I intend by that is all of its systems, everything that makes up the Western world. What we are witnessing is the end of their system of jurisprudence. The court system in this country is a joke. We've reached the end of their system of law enforcement. They've reached the apex of law enforcement in this country. And so policing now, it's a joke because it has reached its apex. It can't go any further. And so if you want to know how to properly deal with that, just don't don't get involved. Leave police alone and let it run its course. It's at the end. Likewise with medicine. Western medicine has reached its apex. It did so maybe 40 years ago. It has been ineffective since that time. There are still some good that comes out of it, but when you understand the way God works and the way God creates a thing, no matter what is created and no matter how much bad it may contain, there's still good in it. And so there is good in Western medicine, but it has reached its apex, and it can't go any further. And so if Western medicine can't go any further, and it cannot, then there has to be something on the horizon to replace it. And we believe that that replacement for what we've known since the days of the Egyptian, is the replacement of Western medicine. That replacement is simply going back to the way that it was before the rise of Western medicine under the Egyptians. They utilized the physician. There is a difference with the physician and the medical doctor. The physician is the person that knows how to set a bone, to remove a gallbladder that's about to rupture, and to open the chest and repair some artery or vein in the heart. That's the work of a physician. The medical doctor is only about 150 years old, if that much. And the medical doctor took the work of the Egyptians in their use of some plant-based materials and turned them into therapies to treat diseases. But when the Europeans got involved, they added the chemicals to it, chemicals that you mine from the earth, chemicals that you extract from rubber, from plastic, from substances, from oil. And they made what is now called drugs or medicine. And it has come to an end. So, what we're doing is we're going back to what the treatment of diseases were before the advent of Western culture, Western so called civilization. And we're utilizing the body's own factories. And since someone or something has interfered with the human's body's ability to produce its own. I don't want to use the word drugs because the body was here and doing this work before the word drug was invented. So, what was it called before Western clinicians developed the word drug, the word treatment, and the word medicine? We just said health. That's all. And the products that we are now mimicking are from the body's own ability to make these products, like the interferons and so forth. And so we have developed a system that will address every component of the human being and his suffering. We have a system that addresses social diseases because people are suffering from far more social diseases than they are biological diseases. And what I mean by biological diseases, cancer, pneumonia, flu, cold, headache, stomachache, diarrhea, digestion. These are biological diseases. But just before we started this interview this evening, I was reading in the news that uh, a woman in the Air National Guard, I believe, or the Army, committed suicide because she had been raped in Iraq by her supervisor when she was in the desert. And she reported the rape and nothing was done. And I'm only quoting what the news article said. I don't know firsthand. Then the woman was sent to Afghanistan and she was gang raped. And she reported that. Nothing happened. So the woman committed suicide. Another article in the same news setting I read a few minutes ago. A woman in Florida was in a hotel with her boyfriend. The woman ran out of the hotel screaming, "He's going to kill me." The man ran her down, caught her, hit her in the head with a baseball bat. She fell on the ground, and he hit her 15 more times while she lay motionless on the ground. Those are social diseases, people. Those are diseases that have to be treated. And what we're announcing to you is that our health paradigm includes the help that people need to deal with social diseases. People are dealing with mental illnesses, mental problems, where a boy was molested by his uncle, the preacher, the camp supervisor when he was 6, and nobody ever addressed it. So today we get phone calls from people who are dealing with issues like that. People need help, and people need more than just some kind of aspirin or Tylenol. People need real help. And medicine, as we've known it for the last 150 years, is no longer able to address those things. So if you want that kind of help, get in touch with us. Natures V.com and health at its best .net. Dr. Patrice Muhammad and Mr. Eric Ahad Muhammad. And we can address those things. We just purchased about 75 acres of land where we will be growing naturally meat, fruits, and vegetables. For those of you who don't know, I grew up on a farm in Mississippi. I have I have 2 degrees in agriculture, and I farmed all my life. And I worked as an analyst with the United States Department of Agriculture in Washington, D.C. I worked as a fishery scientist with the government of the District of Columbia. I managed a catfish farm in Mississippi when I finished graduate school. So we can pretty much grow anything. Right now in Georgia, we're growing halal and natural sheep, goat, beef. Soon we will be growing pasture poultry as well as halal chicken. We'll be growing quail, pheasant, and different breeds of chicken. And it will either be all natural or it will be halal. So, and we will be able to prove the quality of our products. So those are just some of the healthcare system that some of is already in operation, Mr. Ahad, but some are forthcoming.
Thank you so very much. I know that time is always on your mind. We're at the 51st minute of this broadcast. Um, any closing remarks that you would like to say to our audience, Mr. Victor Muhammad? We thank you for sharing what God has given to you. We are taught that when the people are in need of an answer from God, God will create a woman to bring forth a human being with that answer. And obviously, with the history that you have in this world of science, God has given us a great gift in you as a biomedical research scientist. Any closing remarks, Mr. Muhammad?
Uh, I've been listening to National Public Radio in the morning uh, when I drink my coffee after prayer. And there's a great deal of discussion on vaccines. We did an interview, a show that you can find on YouTube some months ago where we addressed the vaccine issue. Now, we can't tell you what to do, and I'm not a medical doctor. I can't prescribe anything for you. Uh, I used to produce vaccines when I was a scientist in the laboratory working for some pharmaceutical companies. I also used to produce antibodies. I know how to do it. And I don't know of any way that a company can produce an effective vaccine in 6 months or 8 months. I
Mm-mm.
don't know how that can be done.
No.
Furthermore, furthermore, um, your body belongs to you, and you have the last say over what goes into your body, regardless of what anyone says. My advice to you, if you are reasonable, if I were you, I would not allow anyone to inject any vaccine into my body, not unless I, Brother Victor Muhammad, produce the vaccine and I tell you that it's good. If I look you in the eye and say, brother, sister, ma'am, sir, you can take this vaccine, it's good. Unless I say that, if I were you, I wouldn't take it. That's all that I can say. Thank you, Mr. Muhammad.
We'd like to thank you, Dr. Patrice. Tonight, you are the blessing that puts the balance to this equation
Yeah,
between the two brothers.
yeah, she's a
So we're
champ.
she is the glue.
Yeah, she's a champ.
And we like to thank our viewers for tuning in. We will be back to you shortly within this near future because there are a lot of subject matters that we need to cover and you need to understand where we are. We know you have a lot of questions. So if you have any questions, you can go to healthatisbest.org to have a medical perspective from Dr. Patrice. If you would like to reach out to natures-v.com, your immunotherapy company, or speak directly to Mr. Victor Muhammad at natures-v.com. Just feel free to send us a message there. We appreciate your time. We're 55 minutes in. We don't abuse your time. We hope that Allah, God, has blessed us with the ability to give you something of benefit for your health this evening. I'll give everybody the greetings and say thank you, Dr. Muhammad and Mr. Muhammad. If you'd like to greet everybody as we go, uh, feel free. Thank you all for tuning in, and please tune in soon again to Life Sciences, How to Eat to Live on your Facebook page, Nature's V, Autoimmune Disease Foundation on your YouTube page, or go to healthatitsbest.org. Thank you all for
Thank
coming
you.
on this evening, and thank you, Mr. Victor Muhammad and Dr. Patrice Muhammad.
Thank
Peace.
you.